So, this paper was kind of looking at this neuroscience and biobehavior reviews, basically using benzodiazepines and Z drugs in pregnant patients. Okay. So, why are we concerned about this? These drugs easily pass through the placenta and the fetal brain barrier. These bind to GABA receptors. It can potentially impact the fetal central nervous system. It's definitely plausible that this impacts fetal growth. Like, why not? It kind of makes sense from a theoretical standpoint. Does this actually make sense, though, when we look at the hard data? Maybe yes, maybe no. But there is some association between benzodiazepines and Z drugs for spontaneous miscarriage, preterm birth, C-sections, low birth weight, small head circumference, low APGAR scores, and most especially when they're used towards the end of pregnancy, right before that baby is about to pop out. Elevated risk for low muscle tone, neonatal respiratory distress, and basically the baby withdrawing. This makes sense, but I think it's very unfair to say this is purely from the drugs too, right? Like, remember, the pregnant patients that are choosing to consume these medicines are also arguably maybe some of the least healthy patients too. This is not basically a double-blinded understanding of these medicines.
So all those things sound very scary, Logan.
Absolutely.
Right. So we're about 42 minutes in. So I don't want to leave this conversation off on that scary note.
Right.
So can you just quickly remind us one more time, what are some of the benefits? Like, what is the real dangers of untreated insomnia in patients dealing with pregnancy? Because the things that you said, honestly, they terrify me. So I can't imagine what an expecting mother would feel when they hear those kind of side effects and potential risks.
Right. Great question. So, let's just kind of go over this real quick again. Consequences of insomnia in pregnant patients. And this is kind of extrapolated some of it from the general population. Increased cardiovascular disease. That means heart attacks. That means strokes. That means clots. Insomnia can trigger stress, which leads to increased amount of cortisol that can impact blood pressure not only for you, but for the fetus. Increased pro-inflammatory states can lead to adverse outcomes. And also, insomnia can lead to gestational diabetes as well as gestational hypertension. So it's kind of damned if you do, damned if you don't.
I was just about to say that, Logan. At times, it feels like in medicine, sometimes we're choosing between the lesser of the two evils.
Right. One thing I actually found interesting in this education that I did for myself is I almost assumed that these medicines led to congenital malformations. What we're actually understanding is in the last decade, there was a lot of meta-analysis with this, that they actually are not necessarily associated with the scary teratogenic effects, as maybe we once assumed.
I think this is a very good barometer, and this is how I kind of gauge my honest perspective towards the medication. If this was your wife, pregnant with your child, and she was dealing with insomnia, she's taken CBT for insomnia, does not work.
Mm-hmm.
Are you taking her to your physician and saying, hey, I think she needs to be on a benzodiazepine?
I don't like to make that decision because I think what I want to do with my patients is shared decision making. They need to understand the risks and benefits. There, of course, is benefits of getting good quality sleep. There are risks of when you're dealing with significant insomnia, both for you and for your, soon-to-be baby, but the fetus growing inside of you. There are risks to using benzodiazepines and these Z drugs we're talking about. Cognitive development, it's showing that at the age of 5, there's an increased risk of lower communication skills. A drug named clonazepam. There was an association with intellectual disability at the age 10 when compared with controls. When clonazepam was used with normal antidepressant therapy, overall decreased mental development at 2 years of age. So yeah, there's definitely some possible harms to cognitive development. These are, remember, observational. We can't make insane conclusions, but you're right. It's scary. There's even some concerns with emotional development. Benzodiazepines has been shown to increase anxiety and internalizing behavior in children ages 1.5 to 3. There's concern of possible behavioral development. The data was a little mixed around ADHD, aggressive behavior, but one thing that did kind of stand out is exposure to benzodiazepines in late pregnancy was associated with an increased risk of ADHD. It wasn't seen as much with these drugs that were used throughout the entire course of pregnancy. So who knows?
Starting to sound like one of those drug pharmaceutical commercials.
Right.
They tell you
At
how
the
good
end.
great is, and then talk to your doctor.
Right. There are implications in even motor skills development. The babies who are born with mothers who use these medicines potentially have lower gross motor skills, fine motor functions. It's the patients need to be aware of all of this. These medicines definitely can cause direct damage to the fetus and soon to be baby. Whether it's those medicines pass through the blood-brain barrier, messing with neurotransmitters. We've currently we of course have seen an association with, like I said, preterm birth, low birth weight, low ABCAR scores. All of this stuff leads to neurodevelopment problems. But always remember, that this study, we can't conclude everything is necessarily fact. Like I keep saying, there are confounding variables that are impacting this. The patients that are likely to use these medicines are the least healthy, arguably. They're the ones who are maybe already dealing with depression at baseline, other mental health issues. Maybe they have unstable housing, and so that's a big issue why they can't sleep. Maybe they're dealing with significant pain, so we can't always extrapolate that these medicines are the ones necessarily causing the problem. It could be a whole slew of other issues. And I think that was really my biggest takeaway from all of this is, treating insomnia is complicated. Is this because you're dealing with some other issues that maybe we can address? Things that are, of course, outside of our control as physicians, but I think something that we need to talk about. Do you live in a safe home? How's the relationship with your partner or your family or your friends? Do you have any support? How has this been progressing? How's your sleep changed as you've gone through this pregnancy process? I think part of it is also educating the mother, right? Like it's anticipated your sleep is going to get worse throughout pregnancy. What are the things we can do to try to treat this without pharmacology? And look, when things get really, really bad, I think that there are a lot of mothers out there that will agree that they don't want to use any medicine. I don't want to use any medicine. My baby's potentially going to get harmed because I'm using medicine. Yeah, but if you don't get any sleep, you're also going to potentially harm yourself and the baby too. So it has to be a shared decision, and I like to think of us as physicians as, I always use this analogy, we're the car mechanic. We understand the engine better than everybody, but you're driving the car, okay? You got to make this decision where we go with this car. I can tell you exactly how it works, how we want to adjust things and tweak things, but you're the driver. What are we doing here? And that's how I pose my decisions with my patients.